Hi everyone, I'm Dr. Stuti Khare Shukla, MD Dermatologist and Clinical Director of Elements of Aesthetic Clinics. Friends, my patients call me fondly Hair Growth Queen of India because of the innovative treatments that I have brought not just in India but also globally. Today I'll be sharing you the story of innovation in trichology in terms of non-surgical hair growth treatments. Few years back, when I started my practice, males as well females who used to have hair loss issues, they have to undergo hair transplant surgeries, which were painful, dreadful, and also sometimes very invasive. I understood the lacunae and I wanted to address that. So this is a story about innovation, research, and bringing a great difference in patients' lives. Guys, we know that out of 100 people nowadays, at least 40 to 50% people, be it male or females, have hair loss issues. It's such a common problem which we see not just amongst the old people, but now it's also common amongst the people who are teenagers and people who are in their 20s and early 30s also. And sometimes patients come with such horrific stories, and one such patient who came to me with her horrific story motivated to me and actually made me do better in the field of clinical non-surgical hair growth treatments. So let me tell you about how the innovation came. I have done a lot of fellowships from USA, Singapore, Bangkok, and my background is completely into research. And when I started my practice in India, I understood that there is a lacunae wherein people had to choose options which were either very dreadful, or patients used to let go their hair thinking that, oh, hair loss is like a common issue, let it be because hair loss, it is not harming the body. So we had to bring a change wherein people could actually be leading a cosmetically well of life without undergoing any kind of side effects. So let me share you such examples of certain people who came to me and certain people who were having issues in their personal life as well. So see, in our country, India, we often actually neglect the cosmetic concerns, thinking that it's only meant for rich people or it's only meant for people who are in the glamour industry. In my 10 years of practice, I've understood that it's not just only for the glamorous people or only for the elite audience or only for the people who are super rich. It affects the middle class, lower middle class, and people who are not from a very well-off background as well equally. I used to think that earlier in my practice that only the females get affected because of the hair loss concerns. Nowadays, I'm seeing more and more males also getting affected. And the problem is that there is a paradigm shift which has happened in last 5 years, wherein we doctors used to see a lot of people having hair loss issues after the age of 25, 30. But unfortunately, we are seeing it at a much younger age. Maybe the teenagers also are getting affected. I once in a month see at least 10 to 12 patients who are below 18 years of age, below 15 years of age, and having baldness like how males used to have at the age of 50 or 60. That's a very dreadful condition and very sad because children, they start losing their confidence. Children start getting, body shamed. They are teased by the fellow colleagues by themselves. And that is what actually affects the confidence. That is what actually affects the well-being of a person. And it's not just about the kids. It's about the adults also who are in professional life. And also for housewives who have to listen so many times from the society, from the people around them. So let me share you one story of a patient. There was a patient who was very pretty, very beautiful, and she came all the way from Indore to my Bombay clinic. She told me, Doctor, I have heard a lot about you, and if you don't treat me, I would rather commit a suicide. She was having alopecia universalis, a condition wherein a person not just loses hair on the scalp, but also on the entire body. It's an autoimmune condition. Unfortunately, out of 100 people, 0.5% people can have alopecia universalis. And there is a cure for it, there is a hope for it, but few years back, there was no cure at all. A person was dependent upon steroids, which used to rather give them a lot of side effects. So when this patient came to me, I was actually going for a fellowship in USA. And this patient told me that, doctor, I have a 6-month-old child and I'm ready to do anything because I'm getting divorced and I am not in a financial position wherein I can, raise my child alone. I tried to motivate her a lot. I tried to give my best, but all that I could see in her eyes was disappointment. Guys, that was the situation that made me do something for her, and actually this changed my life as well. So when I went for fellowships in USA, that time there was a drug which was under trial, and I was in touch with so many clinical researchers as well, and I was in touch with so many scientists as well as doctors as well. And somehow when I got convinced that this could be a good option, and that drug was finally, we were very fortunate that released in India also in a few days. And I just texted that patient that, hey, I have something for you, and maybe you can consult me back again. She came with her hope, and I said that I'm trying my best. And after 6 months when she came with all her hair, with great results, dramatic improvement, and with a big smile on face. That was the most precious thing a person can hold. And she told me, doctor, you helped me in saving my life, and now I am like becoming independent. I am actually doing some fashion designing course, and I blessed her. And now this girl comes to me after 6 months again with a very good news that she has launched her own small boutique, and she's having 3 personal assistants also for her. And she is also doing a great job in helping female empowerment. And this girl is now getting married to another person who has accepted her for what she is. So this was a story wherein a doctor could actually help the patient, not just like actually helping with the clinical issues that she was having or cosmetic concern that she was facing, but also in boosting the confidence level, and that patient could actually help making the society a better place to live by empowering the other females. I'll also share about my male patients who actually have to undergo a lot of situations in their professional lives as well. Baldness is like looked down upon by many people, have actually faced in their day-to-day life. They have actually faced not just in professional but in personal life also. Not just males, females even more, all the more face it. And it's called as a condition. Sometimes females have female pattern hair loss when they start developing bald patches across the skull. Sometimes it's thyroid related, sometimes it's PCOD related, and sometimes it's also because of the various cosmetic treatment of the beauty salon treatments people do. So my advice to people across the world who are listening to the podcast is that they need to understand their hair, they need to understand their body, and at the right time they need to approach the doctors, they need to have a clinical checkup done. Because sometimes when you do a delay, then you're trying your home remedies, and sometimes that actually leads to a very advanced stage wherein the medical treatment might or might not work. So if you're having hair loss, there are solutions. There are actually treatments without the painful surgeries that can actually help you and get your confidence back with the help of the non-surgical treatments. I wish the world could actually be free of all the prejudices and all the biases that we hold cosmetically. But till the time we are actually in a world wherein people are body shamed for certain issues, we need to make sure that we hold our confidence in the best possible way, so that whether we have an issue, cosmetic issue, or any psychological issue, we are confident enough in ourselves, seeing the inner quality, not just judging ourselves with the looks that we hold for ourselves. So guys, trichology is something which is very much deep. It's just not about your hair or the gorgeous crown that you wear on the scalp. It's also a lot about the confidence that you hold in your day-to-day life. Fortunately, in today's world and with today's researchers, there are various treatments which are available which can actually help you regrow hair. One such treatment that I formulated which actually helped so many people, and now we have like 1 lakh plus patients who have been treated across the world. And these patients, the best part of the treatment is that they can avail it at the comfort of their home. Sitting in USA, people are able to avail the hair growth treatments, and because of which they are gaining hair, growing hair, making themselves stronger, not just cosmetically or not just trichologically, but also with the confidence that they are holding. Fortunately, now technology is actually helping. Now, when we started our practice like 7 years back, we used to do face-to-face consultation. But the good thing about technology, and after COVID, it has evolved the world. So the patients, the clients are sitting in USA, UK, Australia, Dubai, and still availing the best of the treatments. So I'm very happy that actually through that treatment, 1 lakh plus patients could get benefited. I'm very sure that in the coming time, entire hair loss industry would be evolved with the hair loss treatments, and everybody can actually lead a very confident life. Wishing you all the very best for everything. Thank you very much.